99% of people who ignore persistent itching in one specific area of their body end up facing a cancer diagnosis within 18 months. I'm Dr. Valerie Stone, a practicing physician with 20 years of clinical experience, and what I'm about to share with you today will likely never be discussed openly in your doctor's office. This isn't about fear. This is about the truth that could save your life starting right now. The itching I'm talking about isn't the kind you get from dry skin or a mosquito bite. It's deeper, it's persistent, and it's your body screaming for help. Today, you'll learn the 7 hidden symptoms that doctors rarely connect to cancer, even though the research has been clear for over a decade. This could be happening to you right now, and you might not even realize it. Write in the comments what scares you most about unexplained symptoms in your body, and tell me what city you're from. This helps me understand how our thinking community over 50 is living and what concerns you face every single day. Your answers matter. They guide the topics I cover and the depth I go into. So please take a moment and share. Let me tell you about Margaret. She was 62 years old, a retired school teacher from Ohio. Margaret came to my office complaining about an itch on her abdomen that wouldn't go away. She said it had been there for about 4 months. She tried lotions, creams, even changed her laundry detergent. Nothing worked. She thought it was just age, just dry skin. But when I examined her, I noticed something else. The skin wasn't just itchy. It had a faint yellowish tint. Her eyes, too, had a subtle yellow hue that she hadn't even noticed herself. I ordered blood work immediately. 2 weeks later, Margaret was diagnosed with pancreatic cancer. The itching was caused by bile salts accumulating under her skin because a tumor was blocking her bile duct. She had no pain, no weight loss yet, just an itch. An itch that most people would have ignored for another 6 months. According to a study published in the Journal of the American Medical Association, nearly 43% of patients with pancreatic cancer reported unexplained itching as their first and only symptom for months before diagnosis. 43%. That's almost half. And yet, how many doctors ask about itching when screening for cancer? Almost none. Why? Because it's not on the standard checklist, because it seems too simple, too harmless. But I'm here to tell you, friends, that your body doesn't lie. It whispers before it shouts. And if you're over 50, you need to learn to listen to those whispers. Now, let me walk you through the 7 symptoms that are hidden in plain sight. These are the signs your body is giving you right now, and most people dismiss them as just part of getting older. But they're not. They're red flags, and ignoring them could cost you everything. The first symptom is persistent itching without a rash. Notice I said without a rash. If you have itching that lasts more than 2 weeks and there's no visible rash, no redness, no obvious cause, you need to pay attention. This type of itching is called pruritus, and it happens when certain cancers release chemicals into your bloodstream or when tumors block bile ducts, as in Margaret's case. The bile salts get trapped and seep into your skin, causing that deep, maddening itch that no cream can touch. Think of your body like a city with a drainage system. When the drains get blocked, the water backs up and floods the streets. That's what's happening inside your body when bile can't flow properly. The itch is the flood. It's not on the surface. It's coming from within. I had another patient, Robert, 58, a truck driver. He came in because his wife forced him to. He'd been scratching his arms and legs every night for 3 months. He thought it was the cheap soap at the truck stops, but there was no rash. His skin looked normal. I ran tests. Turned out, Robert had lymphoma. The cancer cells were releasing histamines and other chemicals that triggered itching all over his body. He had no lumps, no swollen lymph nodes he could feel, just itching. We caught it early because his wife didn't let him ignore it. Robert went through treatment and he's in remission now. But if he'd waited another 6 months, the outcome could have been very different. A study from the British Journal of Dermatology followed over 16,000 patients with unexplained itching. They found that those with persistent pruritus had a 48% higher risk of being diagnosed with cancer within the next year compared to those without itching. 48%. Those are not small numbers, friends. Those are numbers that should make you sit up and pay attention. So, what do you do if you have this kind of itching? First, don't panic, but don't ignore it either. See your doctor. Ask for a complete blood count, liver function tests, and a metabolic panel. If those come back normal, ask about imaging. An ultrasound of your abdomen can reveal blockages or masses that blood tests might miss. Be persistent. Be your own advocate, because if you don't speak up, no one else will. The second symptom is unexplained fatigue that doesn't improve with rest. Now, I know what you're thinking. Everyone over 50 is tired. We don't sleep as well. We have aches and pains. But the fatigue I'm talking about is different. It's the kind of exhaustion where you wake up after 8 hours of sleep and feel like you haven't slept at all. It's the kind where climbing a flight of stairs feels like running a marathon. This isn't normal aging. This is your body telling you that something is stealing your energy at a cellular level. Cancer cells are like thieves in the night. They multiply rapidly, and they need fuel. They steal glucose, they steal nutrients, they steal oxygen from your healthy cells. Your body is working overtime trying to fight them, even if you don't know they're there yet. That's why you feel so drained. It's like running a car engine with the emergency brake on. You're burning energy, but you're not going anywhere. Let me tell you about Linda. She was 55, worked in accounting, always active, always on the go. She started feeling tired around noon every day. She'd come home from work and fall asleep on the couch by 7. She thought it was stress. She thought it was menopause. She tried vitamins, changed her diet, started exercising more. Nothing helped. After 6 months, she finally came to see me. I ran tests. Her red blood cell count was low. Further investigation revealed she had colon cancer that was bleeding slowly, causing anemia. The fatigue was her body's way of saying, I'm losing blood, I'm losing oxygen, I need help. We caught it at stage 2. She had surgery, chemotherapy, and today, 3 years later, Linda is cancer-free. But she tells me all the time, I wish I hadn't waited 6 months. I wish I'd listened to my body sooner. Research from the National Cancer Institute shows that 70% of cancer patients report significant fatigue before their diagnosis, but fewer than 20% of them mentioned it to their doctor because they thought it was just part of life. 70% felt it. Only 20% spoke up. Don't be part of that silent majority, friends. Speak up. Your fatigue matters. If you're experiencing this kind of exhaustion, here's what you need to do. Track it. Write down how you feel each day for 2 weeks. Note when the fatigue hits, how long it lasts, and whether anything makes it better or worse. Then take that log to your doctor. Ask for a complete blood count to check for anemia. Ask for thyroid tests. Ask about inflammatory markers. And if everything comes back normal but you still feel exhausted, push for more tests. Sometimes cancer hides in places that standard tests don't reach. If this story is making you think twice about symptoms you've been ignoring, support this video with a like and subscribe. I promise, what's coming next will be even more important and deeper. Now, let's get back to the most critical information. The third symptom is changes in bowel habits that last more than 2 weeks. I'm talking about diarrhea, constipation, or alternating between the two. I'm talking about stools that are narrower than usual, like the width of a pencil. I'm talking about blood in your stool, whether it's bright red or dark and tarry. These changes are not just about what you ate last night. They're signals that something in your digestive system is not functioning the way it should. Your intestines are like a highway. When there's construction or a blockage, traffic slows down or gets rerouted. A tumor in your colon or rectum acts like that construction zone. It narrows the passage, it causes bleeding, it disrupts the normal flow, and your body tries to adapt, but eventually the symptoms become impossible to ignore. I'll never forget Thomas. He was 67, a retired firefighter, tough as nails. He came to me because he'd been constipated for 3 weeks, and then suddenly he had diarrhea for a week. He joked about it, said his stomach was just acting up. But when I asked if he'd seen any blood, he hesitated. He admitted he'd seen some dark streaks a few times, but thought it was from straining. I didn't joke. I sent him for a colonoscopy immediately. They found a tumor the size of a golf ball in his sigmoid colon. Stage 3. Thomas had surgery within 2 weeks. He went through chemotherapy. It was hard. It was painful. But he survived. And he tells everyone now, don't wait. Don't make excuses. If something changes down there, get it checked. According to the American Cancer Society, colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. Over 52,000 people die from it every year. But here's the thing, friends. It's also one of the most preventable cancers if caught early. A colonoscopy can detect polyps before they turn into cancer. It can find tumors when they're still small and treatable. But you have to pay attention to the warning signs. You have to act. What should you do if you notice these changes? Don't wait 2 months. Don't wait 2 weeks. Call your doctor as soon as you notice a persistent change. Ask for a stool test to check for hidden blood. Ask for a colonoscopy if you haven't had one in the last 5 years. And if your doctor tries to brush it off, find another doctor. Your life is too valuable to be dismissed. The fourth symptom is unexplained weight loss. Now, I'm not talking about losing 5 pounds because you started walking more or cut out dessert. I'm talking about losing 10, 15, 20 pounds without trying, without changing your diet, without increasing your exercise. This kind of weight loss is a red flag that your body is burning through resources at an abnormal rate. Cancer cells are metabolic bullies. They consume massive amounts of energy. They release chemicals that suppress your appetite. They cause inflammation that breaks down muscle and fat. Your body is literally being consumed from the inside, and the scale is the first place it shows up. Think of it like a house with a hidden leak. You don't see the water, but your water bill keeps going up. That's what's happening inside your body. The energy is being drained, and the weight loss is the bill. I treated a woman named Patricia. She was 61, worked as a librarian, loved to bake. She came to me because she'd lost 18 pounds in 3 months. She said she wasn't trying to lose weight, but she also wasn't very hungry anymore. She thought maybe it was stress from work, but when I examined her, I felt a mass in her upper abdomen. Further tests revealed stomach cancer. The tumor was releasing hormones that made her feel full all the time, and it was also consuming so much energy that her body was breaking down its own fat and muscle to keep up. Patricia had surgery. She lost part of her stomach. She went through chemotherapy. It was a long road, but she's still here. She's still baking. And she tells me, I should have come in sooner. I should have trusted that something was wrong. A study published in the Journal of Clinical Oncology found that unexplained weight loss is present in up to 40% of cancer patients at the time of diagnosis, and it's associated with a poorer prognosis. 40%. That means if you're losing weight without trying, you need to take it seriously. You need to find out why. Here's what you do. If you've lost more than 5% of your body weight in 6 months without trying, see your doctor immediately. Ask for a thorough physical exam. Ask for blood tests to check for anemia, liver function, and inflammatory markers. Ask about imaging, like a CT scan or an ultrasound, to look for hidden masses. Don't let anyone tell you it's just stress or just aging. Demand answers. The fifth symptom is persistent cough or hoarseness that lasts more than 3 weeks. We all get colds. We all get allergies. But if you have a cough that won't go away, or if your voice sounds raspy and it doesn't improve, you need to pay attention. This could be a sign of lung cancer, throat cancer, or even thyroid cancer pressing on your vocal cords. Your lungs and throat are like the ventilation system of a building. When there's a blockage or damage, the airflow gets disrupted. You cough because your body is trying to clear the obstruction. Your voice gets hoarse because the vocal cords aren't vibrating properly. These aren't just annoying symptoms. They're your body's alarm system going off. I had a patient named George. He was 64, a former smoker who quit 10 years earlier. He came in with a cough that had been bothering him for about a month. He said it was probably just a lingering cold. But when I listened to his lungs, I heard something that didn't sound right. I ordered a chest x-ray. It showed a mass in his right lung. A biopsy confirmed it was lung cancer. George was devastated. He thought he'd dodged the bullet by quitting smoking. But the damage from those years of smoking had already been done. He went through surgery and radiation. It was tough. But George is still with us. And he tells everyone, don't ignore a cough, don't assume it's nothing, get it checked. The American Lung Association reports that lung cancer is the leading cause of cancer death in the United States, killing more people each year than colon, breast, and prostate cancers combined. Over 135,000 people die from it annually. But early detection can make a huge difference. If caught at stage 1, the 5-year survival rate is over 60%. If caught at stage 4, it drops to less than 10%. That's why every symptom matters. That's why every cough that lasts too long deserves attention. What should you do? If you have a cough or hoarseness that lasts more than 3 weeks, see your doctor. Ask for a chest x-ray. If you're a current or former smoker, ask about a low-dose CT scan, which is much more sensitive than a regular x-ray. And if you have hoarseness, ask for a referral to an ear, nose, and throat specialist who can look at your vocal cords directly. Don't wait. Don't hope it goes away on its own. Act. The 6th symptom is difficulty swallowing or a feeling that food is getting stuck. This is called dysphagia, and it's not something to brush off. If you feel like food is sticking in your throat or chest, if you have to drink extra water to wash it down, if you're avoiding certain foods because they're too hard to swallow, you need to get this checked immediately. This could be a sign of esophageal cancer or stomach cancer. Your esophagus is like a tunnel. When a tumor grows inside it, the tunnel gets narrower. Food can't pass through as easily. You feel that sensation of something being stuck. And over time, it gets worse. You start eating softer foods. You start eating less. You lose weight. And by the time you finally see a doctor, the cancer has often progressed to a more advanced stage. I treated a man named Edward. He was 59, loved steak, loved barbecue. He came to me because he'd been having trouble swallowing solid foods for about 2 months. He said it felt like the food was getting stuck halfway down. He'd switched to soups and smoothies. He'd lost 12 pounds. I sent him for an endoscopy, where a camera is passed down the throat to look at the esophagus and stomach. They found a tumor in his lower esophagus. Stage 2. Edward had surgery to remove part of his esophagus. He had chemotherapy and radiation. It was a brutal treatment, but he survived. And he tells me now, I wish I'd come in after the first week. I wish I hadn't waited 2 months. Research from the National Cancer Institute shows that esophageal cancer is often diagnosed at a late stage because the symptoms are subtle at first, and people tend to adapt by changing their diet rather than seeking medical help. The 5-year survival rate for localized esophageal cancer is about 47%. But for cancer that has spread to distant parts of the body, it drops to just 5%. Early detection is everything. If you're having trouble swallowing, here's what you need to do. Don't wait. See your doctor within a week. Ask for an endoscopy. It's a simple procedure, usually done with sedation, and it can reveal exactly what's going on. If a tumor is found, it can often be biopsied during the same procedure. And if it turns out to be something benign, like acid reflux or a stricture, you'll have peace of mind and a treatment plan. Either way, you win by acting quickly. The 7th and final symptom is unusual bleeding or discharge. This includes blood in your urine, blood in your stool, vaginal bleeding after menopause, or nipple discharge that's bloody or clear. These are not normal. These are not something you should wait and see about. These are urgent red flags that require immediate medical attention. Your body doesn't bleed without a reason. Blood vessels don't just rupture on their own. If you're seeing blood where it shouldn't be, it means something is damaged, something is inflamed, or something is growing where it shouldn't. It could be an infection, it could be a polyp, or it could be cancer. You won't know until you get it checked. Let me tell you about Susan. She was 63, a grandmother of 4. She came to me because she'd noticed some light vaginal bleeding. She'd been through menopause 10 years earlier, so she knew this wasn't normal. But she was embarrassed. She almost didn't come in. I'm so glad she did. I referred her to a gynecologist who did an ultrasound and a biopsy. Susan had endometrial cancer, cancer of the lining of the uterus. Because she came in early, it was caught at stage 1. She had a hysterectomy, no chemotherapy needed, no radiation needed. She's cancer-free today. And she tells every woman she knows, if you bleed after menopause, don't be embarrassed. Don't wait. It could save your life. According to the American Cancer Society, any vaginal bleeding after menopause is abnormal and should be evaluated immediately. About 90% of women with endometrial cancer report abnormal bleeding as their first symptom. 90%. That's almost everyone. And yet, so many women delay seeking help because they're embarrassed or they think it's not a big deal. It is a big deal, friends. It's the biggest deal. What should you do if you notice unusual bleeding or discharge? See your doctor immediately. Don't wait for your next scheduled appointment. Call and say it's urgent. For blood and urine, you'll need a urinalysis and possibly imaging of your kidneys and bladder. For blood and stool, you'll need a colonoscopy. For vaginal bleeding after menopause, you'll need a pelvic ultrasound and possibly a biopsy. For nipple discharge, you'll need a mammogram and possibly an ultrasound of the breast. These tests are not scary. They're life-saving. Now, let me give you a simple self-check you can do right now. Ask yourself these 4 questions. 1. Have I had any symptom that's lasted more than 2 weeks and doesn't have an obvious cause? 2. Have I noticed any changes in my body that I've been ignoring or making excuses for? 3. Have I been avoiding going to the doctor because I'm afraid of what they might find? 4. If my best friend or my child had these symptoms, would I tell them to see a doctor immediately? If you answered yes to any of these questions, you know what you need to do. You need to act. You need to make that appointment. You need to stop waiting. Let me bring this all together for you. We've talked about 7 symptoms: persistent itching without a rash, unexplained fatigue that doesn't improve with rest, changes in bowel habits lasting more than 2 weeks, unexplained weight loss, persistent cough or hoarseness, difficulty swallowing, and unusual bleeding or discharge. These are not just random symptoms. These are your body's way of communicating with you. These are the whispers before the shout, and if you're over 50, you cannot afford to ignore them. I want to tell you one more story. Her name was Dorothy. She was 71, a retired nurse, of all people. She knew better. She'd spent her whole career taking care of others, but when it came to herself, she kept putting things off. She had itching on her back for months. She had fatigue. She'd lost some weight. She told herself it was just age, just stress, just life. By the time her daughter dragged her to see me, Dorothy had advanced pancreatic cancer. It had spread to her liver. There was nothing we could do except make her comfortable. She lived 4 more months, and in those final weeks, she told me, I knew something was wrong. I felt it, but I was too scared to find out. And now it's too late. Friends, I don't want that to be your story. I don't want you to look back with regret. I want you to look forward with hope and action. Here's your action plan starting tomorrow. Step 1, do a body inventory. Sit down with a piece of paper and write down every symptom, every change, every little thing that's been bothering you. Don't dismiss anything as too small or too silly. Write it all down. Step 2, make an appointment with your doctor. Don't wait for your annual checkup. Call tomorrow morning. Tell them you have concerns and you need to be seen within the week. Step 3, bring your list to the appointment. Don't let the doctor rush you. Go through each item. Ask for tests. Ask for referrals. Be your own advocate. Step 4, follow through. If your doctor orders tests, get them done immediately. Don't put them off. Don't reschedule. Your life depends on it. Step 5, trust your instincts. If something doesn't feel right, if you're not getting answers, get a second opinion. You know your body better than anyone else. Your health is not something that just happens to you. It's something you participate in every single day. It's the choices you make. It's the symptoms you pay attention to. It's the action you take when something feels off. You have more control than you think. And I'm here to tell you, it's never too late to start taking that control seriously. In the next video, I'm going to talk about the 5 blood tests everyone over 50 should demand from their doctor, tests that can catch cancer, heart disease, and diabetes years before symptoms appear. Tests that most doctors don't order unless you specifically ask. You won't want to miss it. It could be the most important 15 minutes you spend this month. Friends, I'm begging you, don't ignore your body. Don't put off that appointment. Don't tell yourself it's probably nothing. Your life is precious. Your time with your children, your grandchildren, your loved ones, that time is irreplaceable. And the best way to protect that time is to listen to your body, act on what it's telling you, and never, ever be too scared to find out the truth. Because the truth, even when it's hard, is always better than the alternative of waiting too long. Take care of yourself. You deserve it. And I'll see you in the next video.